Welcome to Module 3 of Health and Safety for Family Child Care Providers. This series of short modules was developed to help you learn how to better prepare and provide a safe and healthy environment for the children in your care. In this module, we'll be discussing daily routines and steps you can take within your home to provide the safest environment for the children in your care. The number one priority for child care providers is supervision. Young children do not have the capacity to distinguish the risk of an action. Therefore, they need an adult nearby to help them learn and navigate what is safe and what is dangerous. In the previous presentations, we discussed how to set up the inside and outside of your home to create a safe environment. This presentation focuses on routines you can implement and steps you can take to keep children safe. However, even with safety measures in place, children must be supervised at all times. Your home should have a working telephone, other than a payphone or cell phone, in the child care area. The phone should be kept in working order and available for use in case of an emergency. Adjacent to each phone, you should post a list of all emergency numbers, including 911, local fire and police departments, the local hospital, your family physician, and poison control. You also should have next to the phone the emergency contact information for each child in your care. This includes the names and phone numbers for each child's parent or guardian, or other emergency contacts such as grandparents, neighbors, or family friends. Your home should have a complete and thorough first aid kit. This kit should be located out of the reach of children, but easy to access in the event of an emergency. You also should have a plan for handling medical emergencies, and you should share that plan with the families and the children you care for. Be sure to restock the first aid kit with sufficient supplies after every use. The first aid kit should include the following: adhesive bandages, disposable non-latex gloves, alcohol wipes, scissors, tweezers, thermometer, bandage tape and safety pins, sterile gauze pads, flexible roller gauze, triangular bandages, eye dressing, and a cold pack. Syrup of ipecac should not be included in the first aid kit or used to induce vomiting. In case of communicable diseases, you must let families know if you, a household member, or a child in your care contracts a contagious illness, such as chickenpox, influenza, or measles. Have a plan ready with families with information about who to contact in case their child gets ill and needs to be picked up and brought home. One of the best ways to prevent the spread of illness and disease is to have you and the children in your care regularly wash your hands. Here is a diagram of the proper hand washing procedure. First, wet your hands. Next, apply the soap and rub your hands together for 20 seconds. Then rinse your hands with fresh running water. Finally, dry your hands and then turn off the water with a paper towel. You should teach this hand washing procedure to the children as well. Hands should be washed before and after eating, handling food, or feeding a child. Providing medication. Diapering, using the toilet or assisting a child with the toilet. Handling bodily fluid, such as mucus, blood, or vomit. Handling uncooked food, especially raw meat and poultry. Handling animals. Playing in the sandbox. And cleaning or handling garbage. Diapering and toileting is another area where you should pay close attention to hygiene. The diaper changing area should be set apart from anywhere food is prepared or eaten, including kitchen counters and dining tables. It must include access to a sink with hot and cold running water, and it should be cleaned and sanitized after each use. Soiled diapers should be placed in a closed container that is lined with a leak-proof disposable lining. The container must be emptied daily and kept clean. The bathroom should be accessible to the children in your care. If a bathroom has a lock, it should not be within reach of children. Or, if children can reach the lock, you should have a key readily available in case a child accidentally locks the bathroom door while inside. Toilet training is a critical part of children's development and should be encouraged and supported. Toilets and training chairs should be accessible to young children and located in rooms separate from those used for cooking and eating. Children should not be punished for toileting accidents, or for soiling, wetting, or not using the toilet during toilet training. In addition, best practice discourages using food as a motivator for toilet training. Many family homes include pets, and many young children love pets. However, all pets, including dogs and cats and other domestic animals, should be kept in a safe and sanitary manner, in accordance with state and local requirements. All animals living in your home should have up-to-date rabies or other vaccinations as required. Your pets should never be abused or threatened. In addition, children should be protected from pets that are potentially dangerous to their health and safety. You also should let parents and guardians know about any and all pets in your home. If you or a household member owns a firearm, you must have and be able to document the proper license or permits as required by law. All firearms should be stored unloaded and under lock and key in a place that is not accessible to children during the hours that child care is provided in the home. Ammunition should be stored separately, also under lock and key, during the hours that child care is provided. Homes often include many substances that pose potential risk to children if not stored and handled properly. All over-the-counter and prescription drugs and medicine should be stored in their original containers in a clean, dry area out of reach of children, or in a locked cabinet. Medicines should be stored far away from any items that attract children, such as food or candy. If a child in your care needs to take medicine, you must get permission from the parent or guardian. Never administer medication to a child without written authorization from the family. You and your household members should never use tobacco or alcohol products or take sedative drugs before or while providing child care. You should not drink alcohol or use tobacco within the presence of children in your care. Cleaning materials, detergents, aerosol cans, matches, and other household products also pose a danger to children. These should all be stored in their original containers and kept in locked cabinets out of the reach of children. When caring for children in your home, you should use positive, consistent methods while guiding children on tasks, encouraging appropriate behavior, setting clear limits and rules that children can understand. Praise the accomplishments of children and encourage their attempts at tasks. If children are engaging in inappropriate actions, redirect them to activities that are more favorable. Never hit a child or engage in any form of physical punishment, humiliation, or verbal abuse. Never take away children's meals or snacks as a form of discipline. We have all heard about timeouts, but this is a tool that should be used in extreme cases when everyone needs to take some time away and take a break. For the child, a timeout should not exceed 1 minute for each year of the child's age. As you think about the equipment, toys, and materials that children use in your home, make sure that they are free from hazards such as lead paint, insects, protruding nails, or rust that may be dangerous to children. All items should be kept clean and in good repair. Keep in mind that infants and toddlers should be protected from small objects such as beads, building blocks, or balls that can be swallowed. These need to be stored in closed containers, out of the way of the youngest hands. Toys that explode or shoot, such as caps, guns, and darts, are not allowed. This concludes this presentation on daily routines and steps you can take to provide the safest environment for the children in your care. You may go back and review this recording as many times as you need to understand the content. If you have any questions, please call or email the Center for Early Learning Professionals. Thank you.